Hi, I'm Colin Hung with Healthcare IT Today. And had the pandemic not happened, I am convinced the number one story of the last 18 months would have been info blocking and data sharing in healthcare. But sadly, the pandemic happened. But maybe we did achieve a little bit of data sharing after all. And sitting down to talk with me today about info blocking and data access is Lisa Esch, SVP and Chief Innovation Officer for Healthcare Providers at NTT DATA Services, and Dr. Michael Petersen, Chief Clinical Information Officer, also from NTT DATA Services. Welcome to the program.
Hello, Colin.
Hi, Colin. Thanks for having us.
Yeah, it's fun.
Great to be here.
I think we're going to have a fun conversation.
We are.
So let me start by asking, do you agree with what I said at the beginning? Do you think that info blocking and data sharing would have been the number one story of 2020?
I do believe that that would be the story we'd be talking about a lot more than we really are today. The pandemic forced some organizations to start moving information back and forth in little bits, but patients and consumers still have multiple portals, multiple gaps in how care is delivered around them, and it can be really challenging to get information from the provider point of view as well as from the patient point of view.
What are your thoughts?
Yeah, I agree. I think what the pandemic did is it accelerated health systems, health plans, provider systems to evolve quickly, and what they did is that they had to share data, or they had to get data themselves. So when you think of not just COVID testing, and you talk about, and even public service entities, they all had to innovate really quick. It didn't solve it, but what it did accelerate them to a set point that's different than where it was pre-pandemic. So there is a post-pandemic world, and I think they're going to want to try to hold the innovation gains that they got from this experience, but there's still some more work to do.
Info blocking came out in 2020, and it was supposed to be this big hammer that the government was going to use to force organizations to share data. Should it have been a hammer, or should it have been more of a carrot? I mean, was it going to be effective?
Well, I think that until we really resolve who owns patient data, is it the provider? Is it the organization that hosts it? Is it the patient? That's causing some of the reluctance to actually share data quickly and easily. Right. And so I think that's one of the challenges. But organizations still are doing the minimal thing they need to share data. They've invested in a lot of technology to do that, but there's just the legality around it and all the different standards, which make it really challenging to move information around. And the reality is, patients today don't get healthcare from one system or one place. They have multiple portals, multiple ways they engage with for healthcare, and it's not easy to move that information around.
Yeah, I think it has to be a hammer, and here's why. There's a culture of blocking for this sort of, we've been doing it this way the whole time. And as an example, if you're trying to get your medical records, you literally have to find the basement in the hospital system where you can sign. In the lowest denominator of technology is a fax machine or hand carry it, right? So I think they indirectly, but there's a culture to do that, and I think what Lisa is saying is absolutely true, which is the consumers are going to want to start. They own their data already. I have my apps for all my health data, that's mine, but I may want to share that with a clinician, and you can kind of start to do that. But I do think from a government perspective, if somebody doesn't, no one ever will. And I think it shouldn't be something that the government should have to. We should be following what the trends are technologically. But like I said, I think health systems just inherently aren't able to shift beyond that for, I think it's a fear of legality, but there's pieces you can share, and if you really can protect yourselves with data use agreements and all these types of instruments to protect the patient. At the end of the day, it's always do no harm for the patient, and that's what we should do in data and how we share it.
And the other issue around this is data is like its own currency right now. Data is really valuable, and organizations that have collected that data on patient, whether it's clinical, all the kind of data that you collect around patients, they don't necessarily want to share that information with their competitors when their patients go there. So there's this whole competitive piece of tension that's contributing to the reluctance to share data.
What I'm hearing, though, is that it's not nefarious. It's momentum, it's policy, it's sort of, we've done this this way for many years, and so, but it's not an active, no one's being proactive to prevent the sharing of data. But one thing we were talking about before we got on air here was like, even the pandemic couldn't stop the explosive growth of data inside healthcare. And as you said, it's becoming the currency of healthcare. We're generating gigabytes a day or terabytes a day. And organizations are being bombarded now with requests from multiple angles, not just patients, but other organizations, to access this data. But they don't have the resources, the knowledge, and sometimes they're worried about the liability, as you mentioned, to wrangle all that data and provide it.
You're spot on. And think of all the people they have to hire to move that data, to get that information, to check and make sure that it is compliant, that it's going to the right place in the right way, and that there's no risk or breach around that. And that's like 20, 30, 40 people that could be providing health care at the bedside. And no, they're sitting in an office somewhere managing data. Like, that's how complex our systems have been. And so we really need to think about new ways of addressing that. And there's technology, there's AI, there are ways to address that, to take that labor piece out of it. But it takes an investment, it takes technology, it takes, the people, it still takes people, good process, smart technology, and the willingness to kind of do things differently for the sake of moving forward instead of living in the status quo.
Yeah, I think there has to be a recognition that we need help, and I think what Lisa's absolutely perfectly said, you spend 75% of your time qualifying the data, and you need AI to help augment that work and bring these insights, because there's a lot of noise, right? I mean, think about how much data is collected. If you just look at a heart monitor, what's real, what's needed, what's important in that care of that patient. And I think when you free up I think the other thing, hospital systems or health systems there's an inherent, like, one day we might monetize this data, or we may use it for our own algorithms, et cetera. But your data's it's one slice of it, and in the world we're moving into, you're gonna have multiple sources of data, and you're still gonna need someone to help you wrangle it and ask the right use case questions about what you're trying to solve for. And I think that's where they struggle.
So what does this promised land look like? When we have the right technology, we have the right resources, the right skills in place, what does data sharing look like when we get there for an organization?
That's a great question. And we think about that. And I can't wait till we can be in a room together, all of us, all the great minds that we have, to really do that more than on a Zoom call as we try to figure those things out. But we've got vision for that. We have, there's technology, there's capability, there's things that we can use from other industries that safely do this all the time, that we need to just take some steps towards that and really move forward and just be bold and take the change, make the change to do that. And I also think that it doesn't have to be complicated. We have the capability to fix this. And it's going to probably rub some very large organizations that control those types of things. It's going to cause some tension there. But I think the patient should win, and the consumer should win in this battle. And it shouldn't be a battle, but ask anybody who's tried to get their records from multiple sources. It can be a battle.
Well, it's a battle, but it's also an inappropriate experience people have to be put through. I think that organizations are going to inherently use it. With the future of it, it's going to be that they're going to have to figure out, okay, we don't need to boil the ocean. The patient is demanding this, and we're going to respond to that. If we don't flip, they're going to go somewhere else. And I think that there are, they have to innovate within themselves from a technological, and we're just talking about enablers, right? Enable those possibilities. But I think for them to get there, it's going to take, I think, a will. You can talk about it all you want, but you have to really get to an operational, and you have to partner. Every health system that's successful has partnered with somebody or a group of entities, and you can't solve it by yourself. And so I think that that's going to be the wave of the future, is that, by collaborating more, you're going to have that. So it's happening today, right? Locally, there's counties that are now working with health systems to tackle vaccination challenges or hesitancy. How do we know where but they're still enabling it with technology. They're enabling it with an ability to process all this data in a seamless way. At the end of the day, like I said, the patient's going to make decisions, and those decisions are going to be whether to go to your health system or not. They're going to go to the one that offers them the most convenient experience, and that's just inherently who we are now today.
And that make it the easiest. And it probably will require not your standard partners that you have today. It will require something that will knit those things together and make it easy and take it forward. It's not necessarily what you have today. It will probably require something new.
It sounds like what you're saying is that the data side of the patient experience is going to become even as important, or as important as the clinical side. The convenience of getting access to my information and sharing it with other parts of my care team or other organizations that I might deal with will become a deciding factor when I decide where to go to get my care.
Yeah, today patients bring notebooks, they bring iPhones, full reams of data that they want the clinician to know about that's important to them. Now imagine that exponentially with all the IoT devices, watches, weights, all those things. There's going to have to be a system and a way for that clinician. The point of care timing doesn't change. So now they just have more information, and it's hard to tell a patient that's actually not important, or that is important. I'm glad you told me, but you're going to need someone to be able to take these terabytes of data that they've had for like 6 months, depending on the use case, but someone's going to have to consume that data for them and give the clinician the opportunity to know what are the important things to look at. Maybe they walk 10,000 steps in the month of May, and it's not relevant, but there was an ECG that popped up that showed an irregular heartbeat. That's important, everything else isn't, and you need artificial intelligence, machine learning, you're going to need the systems and the tools all to help derive, because at the end of the day, and I said this all the time, is that healthcare still doesn't matter what surrounds to the entity, it's still a human engagement.
Right.
And there's a doctor, nurse, some sort of person representing the health system talking to a patient. No technology involved in that, but when they leave those conversations, there's activities and things that have to be done for both sides, and we have to help those and catalyze those.
Well, this has been a great conversation. My final question very easily is, where can people find more information about NTT Data Services?
Well, we've got information on our website at nttdata.com in the healthcare section, and feel free to engage and talk with us about that. We've got webinars and all kinds of resources available for that.
Excellent. Well, Dr. Petersen, Lisa, thank you so much for being on the program today. I
Thank you.
really enjoyed the conversation.
Thank you, Colin.
This has been Colin Hung for Healthcare IT Today. Thanks for listening.